This is Gary Atencio with CNTV, and today we're in Canada. I'm here with LivingWell Healthcare Funding Solutions. Since 2015, they've been transforming the way we see healthcare by integrating workplaces, holistic wellness, and benefit solutions. I am joined with the co-founder, Patrick. Thanks so much for joining us here today.
Yeah, awesome to be here. Thanks for having me.
Let's start off a little bit about yourself. You were formerly educated at the University of British Columbia. You're a certified cash flow specialist with past experience as an engineer and financial security advisor. Nearly a decade ago, you began the move into wellness and healthcare. Share with me a little bit how this passion has led you here today.
Yeah, I would say it's a couple of things, couple of events really. Back in, I would say 2014, 2015, we had some really bad forest fires in the interior of BC, up here in Canada. And the smoke got so bad that it drifted over to Vancouver, where I'm based. And unfortunately, I got too much of the smoke and I developed a chronic cough. And so I did what anyone else would do at the time. I went to my doctor, and after a series of questions, he couldn't figure out what was wrong, but proceeded to prescribe me an inhaler anyways. He asked me if I ever had asthma. I said no, but he said, try it anyways. Come back in a couple of weeks if nothing happens. So predictably, a couple of weeks goes by, and it hasn't gotten any better. I'm still struggling to sleep every night because the cough is so bad. And he says, you know what? I can't figure out what's wrong, but maybe try a stronger dose. And at that point, I'm thinking, well, you don't know what's wrong with me, and this clearly isn't working, and I'm not sure what the long-term effects of, putting these medications in my body are. So my wife actually, she's amazing, and she did some incredible research, and it said, you know what? Why don't we get a diffuser, try some essential oils, and see what happens. So yeah, we ended up trying some eucalyptus, some tea tree oil, got a little bit better. And then we went to something actually from my ancestry, some Chinese, what we call Chinese white flower oil, put that in the diffuser, and actually after a few weeks, it cleared right up. It was amazing.
That is fantastic. Thankful to our wives, obviously, that do a little research for us, right? And
Yeah.
a lot better than take a pill and we'll see you a couple weeks. Even in these modern times, with advancements in medical technology, drug research, we still find that nearly half the adults live with at least one chronic illness. Do these stats surprise most people, and yet they're true?
They do. Yeah. The stats themselves are shocking, but when you think about it, when you really think about it, look back at your family, your relatives, your friends, your coworkers, chances are you've known at least one person who's either struggling with some sort of chronic illness or something even more life-threatening like cancer or Alzheimer's.
Wow. I mean, 1 in 2 of us will face cancer. 7 in 10 over the age of 65 will lose their independence. And this exists even where employees have health benefit plans. I mean, this has to be costly for everyone and even the organizations. Tell me about that.
Yeah. So the thing with, employee benefits and our healthcare model, both up here in Canada and in the US, from what I've learned about, it's very reactive in nature. It waits until we're faced with a serious disease, and then it tries to, have us go on the medications, the surgeries, the treatments, and go from there. And unfortunately, it's much more costly at that point, and there's a lot fewer options that we can do for patients and employees and their families.
Eastern medicine has been a lot more proactive than we are in the West. We're definitely reactory. Stats show that the cost is staggering. We're talking $122 billion every year. Your company says there's got to be a better way. Is your mission to change some of those numbers for these organizations?
Absolutely. I would say even in sort of a bigger vision of ours is actually transform the way that we look at healthcare. So instead of a reactive model, I would like to actually see a proactive prevention-based model as the primary healthcare model. not waiting for disease. And I've seen firsthand in terms of adopting holistic practice to my own well-being, but also countless other examples that I've heard about from other holistic practitioners. The so-called lifelong incurable diseases that patients face, when talking to a professional from the medical system, versus them finding relief, maybe not right away, but eventually finding relief using holistic and alternative methods.
Is step number one to simply identify these hidden annual costs of chronic illness? And do your programs help a company do that, realize that they're being affected?
Yeah, absolutely. So, we all know you don't know what you don't know. And so the first thing we need to do is actually look at the hidden illnesses within an organization, what employees are secretly struggling with. Because you go into the office and it's actually more of a struggle now to do so in this virtual world that we live in. But if you were to talk with your coworkers, you don't know whether they're struggling with diabetes, heart disease, maybe depression. They put on a brave face and they soldier on like any good worker would do. But meanwhile, the illness is progressing, and they're not getting the help that they need, and this affects organizations whether they know or not. So we do need to start with that employee assessment to figure this out.
Yes, that's important to know. Do many companies not realize all the ways, directly and even indirectly, how they're affected by these health issues of their employees and even the families?
Yeah, they really don't know. It's really hidden.
Wow. Is it just me, or does it seem like more and more people are getting diagnosed with cancer and other life-changing illnesses? It makes me and probably others question, are we doing enough? Is awareness a big part of what you try to provide as well?
Yeah, it definitely is. Back in my first years as an insurance agent, and this is what insurance companies would do. They would give you all these horrifying stats and then say, okay, well, use these to convince people to buy insurance. Now, don't get me wrong. Insurance is important to have, but in my time in the insurance industry, I've seen the cancer rates, at least in Canada, go from 2 in 5 to 1 in 2. 1 in 3 people will face a serious critical illness in their lifetime, whether it's cancer, heart disease, or a stroke. And unfortunately, despite all the advancements in medicine that we've seen over the years, over the decades, it hasn't gotten better. In fact, it's gotten worse.
Yeah, I agree. Not only chronic illness, but we're talking mental health impacts the workplace. We see Alzheimer's in the news frequently. Are organizations becoming more socially conscious of this, and is that a good thing?
I believe so. Mental health has been a big focus, at least in Canadian companies for sure. A lot of companies are they're scrambling right now. They're, especially post-pandemic, they're trying to figure out ways to support their employees. They're putting more money into things like psychology benefits and counseling and employee assistance programs, which is a great thing. But I believe that we can do more, and I believe that pulling in solutions from the holistic side can really do a lot to sort of enhance that process.
Let's face it, work-life challenges exist today, and it affects the productivity and bottom line of organizations. This really is regardless of the size of company, be it big or small. And do you try to consult with any type out there?
Yeah, because in the end, we're all people, we're all humans, and we all have healthcare needs, and these are unique to each person. So I believe in empowering each person's unique healthcare journey, and I believe that we should be able to do so no matter what size company. We shouldn't have to see that the top benefits only go to organizations that have 1,000 or 5,000 plus employees in their organization. We want to be able to help the micro companies as well, the ones who have less than 10 employees. The mom and pop shops. They have their own healthcare needs too, and I believe that everyone regardless of their background, their walks of life. They should have the same access to choice in healthcare as anyone else.
That is great. It's one of the reasons I wanted to bring you on the show is to expose some of those small business to this as well. I mean, we here in the United States, we look at Canada, and Canada has free health care. So are there hidden costs of this free health care model that maybe people don't always realize?
Yeah, definitely. The first misconception is that it's not actually free. It is funded by our tax dollars, and the more that the healthcare system needs, the more tax dollars that need to be drawn. But unfortunately, there's other areas, whether it's education, the environment, those are all fighting for that slice of the pie as well. And unfortunately, when it comes to cuts, healthcare has been on the receiving end for a lot of that. And that has improved in kind of recent times, but it's definitely something that our system struggles with.
Interesting. I mean, as people struggle with their health and they haven't found the answers they're looking for within the medical system like yourself, is holistic health and alternatives the solution that many people seem to turn to?
People are turning increasingly to these solutions for sure. I do believe there is still a place for the medical system. I mean, if I were to get into a serious car accident, I mean, it definitely would sure, require the skills of a doctor or a surgeon in the hospital to take care of me. But I believe on the chronic side of things, that's where our healthcare systems and employee benefits models fail us.
That is interesting. And do some of these people probably wonder how they can get holistic health and wellness treatments covered by their workplace? Is that becoming more of a concern maybe that folks are turning to this?
Definitely, yeah. People are looking for workers. They're more educated today. They're more empowered, and they're asking questions. They're wondering, well, is my employee benefits plan really supporting me? And not in a one size fits all way, like traditional models use, but is it really speaking to me? And that's where we see personalization and customization becoming increasingly popular features with employee benefits.
Interesting. So what is the first step for these organizations or people to act so that employees and their extended families become healthier and happier? Does this all begin with a consultation with you? Share with me how they reach out to you.
Yeah, definitely starts with a consultation. We'll be launching some education sessions. We're developing a free wellness workshop that we're delivering to workplaces to kind of highlight where people might be struggling and kind of show some solutions that are possible, and just really to spark the conversation around wellness and what that looks like in an organization.
Excellent. As you help organizations become more profitable, create positive social impact, and really produce kind of a ripple effect of health and well-being in communities all across Canada, is this rewarding work for you?
It is. I mean, I can speak to my own history. I lost my dad to cancer when I was 11. And, anyone who's faced that knows what it's like to grow up without a father figure in the household. I mean, you have to grow up really quickly. So, I mean, I want to make sure that no other family has to face what my family went through, what I went through, and hopefully just be able to be the person that I needed when I was a kid.
Let me ask you this. Obviously, there are many services out there that people are able to turn to. Explain to me a little bit how those are covered, or what are some of those areas?
Yeah, so in the traditional benefits model, it very much mirrors our healthcare system. So it's very medical based. It covers seeing doctors. It covers pharmaceutical medicines. But what really lacks typically is on the holistic side. There has been improvements over the years. We've seen things like massage therapy, acupuncture, naturopathic medicine being added. But what's really lacking, and what where we really focus on, is providing coverage for what a lot of people consider those alternative modalities, such as being able to cover herbal medicines, Ayurvedic medicine, yoga, Reiki, and even more, even spiritual modalities like, past life regression or tarot card readings, because wellness is really unique to everyone, and how they see it is unique to them. So we want to be able to provide that choice to everyone as they need.
Obviously, holistic, mind, body, spirit. It takes the entire to be truly healthy, and obviously with a package that has a preventative taken care of as well as reactive, then we're going to be experiencing health care that is beneficial for everyone.
Yeah, absolutely.
That is excellent. It's a great story. Definitely your passion and legacy you're going to leave behind. That is great. Viewers, let's take a look at the bottom of the screen right there. What you're going to see is their website. On the website, you can learn more about this organization. The contact information for them is on the bottom of the screen right there. If your organization is struggling to meet the evolving needs of a diverse and modern workforce, all while staying on budget, and you're looking for a social impact initiative that will improve the holistic health of your community, reach out today, contact them for a consultation. Once again, that is LivingWell, transforming the way we see healthcare by integrating workplaces, holistic wellness, and benefits solutions. This is Gary Atencio with CNTV. And if you don't know, now you know.